Hey everyone, this is Angel at Alternative Health. Urinary tract infections, or UTIs, are one of the most common infections seen in a doctor's office. When you think of UTI symptoms, burning in urination or having to urinate more often probably come to mind. But these classic symptoms are what most people with UTIs experience. But some older adults might show less common symptoms like confusion or what's known as UTI delirium. In medical terms, delirium is a condition in which someone becomes confused over a short period of time. People experiencing these symptoms might also appear aggressive, withdrawn, or restless. They can also experience hallucinations. Other older people don't always show classic signs, and delirium may be the only symptom that they have from a UTI, which can lead to issues with diagnosing the problem. You may be wondering how a UTI can affect the brain. Well, scientists haven't found the exact link, but here's what they believe. Anytime we have an infection, our immune system kicks into gear to fight it off. During this process, our body releases chemicals that causes inflammation. These chemicals can also lead to many of the symptoms we feel, like fever or fatigue. In older adults, the brain is more affected by the inflammation and the stress hormones that the body produces to fight the infection. The effects of this inflammation and stress on the brain are what show up as delirium. So why don't young adults get delirium? This has to do with the blood-brain barrier. It's a special protection between the brain and the rest of the body. Think of the blood-brain barrier like a screen that keeps the bad stuff out and lets the good stuff in. The blood-brain barrier keeps bacteria, viruses, and fungi that threaten the health of the brain from reaching it. The barrier isn't as strong as we get older, so the inflammation from the infection has a higher chance of affecting the brain. After treatment, most older adults will have improvement in the delirium. However, not all delirium is going to be reversible, particularly in people who already have dementia. The bottom line is we need to help our older adults determine if their symptoms could be from a simple UTI. The sooner the UTI is treated, the less likely the infection will spread. The source of this information came from GoodRx. These statements have not been evaluated by the FDA. This is not intended to diagnose, treat, cure, or prevent disease. Thanks for listening.